Can you treat a traumatic hemothorax with a 14 French percutaneous catheter instead of a 32 French tube test? Hi, I'm Cecilia Gijena from Cincinnati's Children's Hospital, and I think this is an article that you should know about. Between July 2015 and September 2020, they evaluated 119 patients with traumatic hemothorax. 56 of them received a percutaneous catheter of 14 French, and 63 received a tube test. And what did they find? They found out that the failure rate, defined as needing a second intervention for the hemothorax, was similar between both groups. Also, the length of stay, the daily drainage outputs, and tube days were similar between both groups. What was significantly different is that percutaneous catheters were much better tolerated. So it seems that you can treat a traumatic hemothorax with a percutaneous catheter. Check back for more articles that you should know.